This is Brittany and I'm taking my head-to-toe physical assessment. Prior to starting the assessment, I would wash my hands and explain the procedure to the patient. Then moving forward in the assessment, I'm going to look at the skin and the nails. I'm looking at the skin, looking for any rashes, open wounds, anything abnormal. Then I'm going to palpate the skin for temperature, dryness, lesions that I can feel, any edema, and the temperature is nice and warm. Looking at the hands and fingers, I'm going to look for clubbing, cap refill, seeing if any nails are missing, and anything like that, which his nails all look good. After assessing the skin and nails, I'm going to move on to the head. And I'm going to look at the hair, running my fingers through the hair, noting hair distribution, noticing if there's any scars, masses, or anything like that of the bones in the skull. I'm going to feel the bones and the cranial sutures. And then moving anteriorly, I'm going to look at the patient's face, palpating the facial muscles, the facial bones, the temporal artery between the ear and the forehead, the frontal sinuses, the maxillary sinuses, the temporomandibular joint. Anthony, I want you to open and close your mouth. I'm listening and feeling for a click. Good. After that, I'm going to move on and I'm going to test cranial nerve 5. And to do this, I'm going to test Anthony and see if he can tell me whether this object is sharp or smooth or soft. So this is going to be sharp. This is going to be soft. I'm going to check that on the forehead, the cheeks, and then the chin. So tell me what you feel.
Soft.
Good.
Sharp. Soft. Sharp. Sharp. Soft. Sharp.
Good. And after that, I'm going to test cranial nerve 7, or the facial nerve. I'm looking for symmetry and movements as I ask him to perform these. Can you smile for me? Puff out your cheeks. Close your eyes nice and tight. Good. Raise your eyebrows for me. Good. After that, I'm going to move on to the assessment of the eyes. I'm going to start with the eyebrows, looking for hair distribution, symmetry, looking at the eyelashes, both upper and lower eyelids. I'm going to look at the conjunctiva, that is nice and pink, the sclera, and the iris. Then I'm going to check cranial nerves 3, 4, and 6. So to do that, I'm going to perform extraocular eye movements. I want you to follow my finger with your eyes only, please. Going up. I'm just taking my time through these, looking for a nice stagnance at all. Good. And then move laterally and up. And then down, back to the center, laterally and up, and down. Good. Then I'm going to look at the direct pupillary response, nice and 3s, and then consensual. So I'm going to shine this eye, I'm looking at the opposite eye. Good. Just looking at the corneal light reflex, and that the light reflects equally in both eyes. To check accommodation, Anthony, I want you to look at the flashlight. And follow the flashlight. Good. And then to check cranial nerve 2, or the optic nerve, normally in practice I would do the Snellen chart. For the sake of this video, I'm just going to check confrontation from his peripheral vision. So please cover your left eye. Don't put any pressure on the eye, just cover it lightly. Stare at my nose, and I want you to tell me how many fingers I'm holding up.
2. 3.
Thank you.
Horrible.
After doing that, I'm going to look at the ears, and I'm looking at the external ear, the auricle, the tragus, the mastoid process, and all the surrounding areas of the ear. I would use an otoscope in practice using the light to look at the tympanic membrane, the umbo, the malleus, and the manubrium, making sure that all of that is intact. To test cranial nerve 8, or the acoustic nerve, I'm going to perform the whisper test. Anthony, I'm going to whisper a word. I want you to tell me what you hear.
Football.
Yes. After checking the ears, I'm going to go on to the nose. I'm going to look at the external nose, palpating the external nose, the septum for any deviation. It's nice and equal. Using my light, I'm going to flash it up, look at the sure it's not deviated in the nasal mucosa, that it is nice and pink. After looking at the nose, I'm going to go on to the mouth. Looking at the lips for any dried, cracked, bleeding lips. Go ahead and open your mouth. Looking at the oral mucosa, it's nice and moist, nice and pink. I would wear gloves and I would look at the teeth and the gums. And then go ahead and stick your tongue out for me. Ah. Looking at the tonsils, I would grade them a 1 for 0 to 25% of obstruction. After the mouth, I'm going to go on to, cranial nerves 9 and 10. So I know that he has a gag reflex just by the way he's talking to me and not choking on a spit or anything like that. But I do want to check for cranial nerve 9. Go ahead and open your mouth, stick out your tongue, say ah. Looking for symmetrical rise and fall of the uvula. Then after the mouth, I'm going to go on to the neck. Looking for symmetry of the neck, palpating symmetry, any masses. This is also where I would check the lymph nodes. So I'm going to check the pre-auricular lymph nodes for any tenderness, post-auricular, the occipital lymph nodes, the submaxillary, submental, the anterior cervical chain, and the posterior cervical chain. And then I want you to shrug up your shoulders. And this is where I'm going to feel the supraclavicular, if any are present. Good. At this point in the neck assessment, I would also look and palpate the trachea and see that that is midline. And then I could also do the carotid pulse at this time. After that, I'm going to move on the upper extremities. So I'm looking at the shoulders for symmetry, looking at the muscles for any deformity, atrophy, anything like that. And I'm also going to use my hands and I'm going to palpate. Good. All the way down into the joints, seeing if there's any inflammation in the joints. Starting with the hands, I'm going to test the range of motion. I want you to put your hands together. Your fingers, sorry. Don't let me open your fingers. Good. And then spread them out. Don't let me close them. Good. Then with the wrist, I want you to kind of spin your wrist, checking range of motion there. And I do hear a little bit of crepitus and cracking there. It's kind of normal for him. Then I'm going to check the strength. Pull back with your wrist. Good. Push down. Good. And the range of motion in the elbow, bend and extend. Good. And then on the other side, I would do that as well. Then I'm going to check the strength. So what I want you to do is arms kind of up like this. I want you to push out against the hands. Good. In. Good. And then moving on to the shoulder. So I'm going to put you through a bunch of different range of motion for your shoulder. I want you to put your arms up. And then back down. Okay. I want you to put them behind your back. Good. Behind your head. Good. I want you to adduct and abduct. Good. After that, I'm going to check the radial pulse. His muscle was a 5 out of 5 for strength. And his pulse in the radial is a 2. And the brachial, which is nice and strong, I would give that a 2 as well. And then above and on the inner aspect, I'm going to palpate the epitrochlear nodes. Good. Following the upper extremities, I'm going to do the lung assessment. First, just watching the patient breathe, making sure they're not struggling to breathe, no shortness of breath, no retractions noted, looking for symmetrical rise and fall of the chest. I'm also going to count the rate, the rhythm, pattern, and things like that. Then I'm going to move on and I'm going to palpate, and I'm going to go side to side, noting any tenderness, good. And then I'm going to percuss again from side to side. This chair's not the greatest. And then I'm going to percuss the costovertebral angle for any tenderness. Has that hurt at all?
No.
Okay. And then I'm going to check chest expansion or excursion. So just right below the diaphragm and putting the skin together, making sure my thumbs go about the same distance. Take a deep breath in and out. Good, and they do. Then, moving on, I am going to use the diaphragm of my stethoscope. and I'm going to listen to the lung sounds. I'm going to hear bronchovesicular up top, noting any crackles, rubs, anything like that, wheezes. And then vesicular towards the bottom of the lung fields. Good. Then I'm going to move anteriorly and go in the same pattern. First I'm going to palpate from side to side, noting any masses, tenderness, anything like that. Is that tender at all? And then I'm going to percuss in the same fashion as I did in the back. Thank you. Good. And then to check the anterior chest expansion. Go and deep breath in and out. Good. And then again, using the diaphragm of my stethoscope, listening to the lung sounds way up here. Going from side to side to bronchovesicular, and then I'd hear bronchial over the main bronchus, and then vesicular as I move down. Good. Next I'm going to move on to the cardiovascular assessment. First I'm just going to look at and palpate the carotid pulse, making sure to do one at a time. And the apical pulse. I'm going to feel the apex and the base of the heart. Good. And then I'm going to use the bell of my stethoscope, listening to the aortic, the pulmonic, tricuspid, and mitral valves, noticing any murmurs, clicks, or rubs. Good. Then I will stop the video and move on to the abdominal assessment.